Dr. Jimmell. I'm back with a new episode of Justice Rounds with Dr. Jimmell. I hope everyone had a beautiful love day yesterday. Yesterday, yes, in fact, was Valentine's Day. So I'm wishing you all a happy belated Valentine's Day, which brings me to the episode that we're going to discuss today. So I am tackling a topic that impacts thousands of families each year: heart attacks. My mission is clear: dispelling myths, defending families, and demanding justice for every patient. We'll explore the facts surrounding heart attacks. I will share how heart attacks have affected my personal family, and I will provide resources and hope for those affected. By this episode's end, I hope to have empowered you and your family to understand, prevent, and advocate for heart health. So let's dive in and stand together for heart health. So we're going to start out with some statistics, 2025 heart attack data. So February is American Heart Health Month, a nationwide observance that spotlights cardiovascular disease and the need for more lifesavers. First proclaimed in 1964 by President Lyndon B. Johnson, American Heart Month began as a national call to take charge of your heart health, a mission that continues today. Heart attacks, also known as acute myocardial infarctions, or MI, remain a leading cause of death in the United States. In 2025, the numbers tell a powerful story about who is most at risk, both nationally and here in South Carolina. So let's talk a little bit about statistics for the nation. In Black Americans, we have higher rates of heart attacks compared to other groups. Black men and women experience roughly 330 new heart attacks per 100,000 people each year. While Hispanic heart attack rates are rising due to increasing risk factors, they're estimated at 220 per 100,000 people annually. And white Americans, in their demographic, the rate is approximately 260 per 100,000 yearly. In South Carolina's, our 2025 estimates, Black South Carolinians, we have a rate that's even higher here, about 370 per 100,000. Disparities in healthcare access and social stressors play a role. For Hispanic South Carolinians, around 200 per 100,000, but these numbers are climbing as the population grows. White South Carolinians have a rate of about 250 per 100,000, with heart disease still the leading cause of death among this group in South Carolina. These statistics highlight the urgent need for targeted education, support, and justice in our communities. Remember, these are not just numbers. They represent real people, real families, and real communities. Personal story: Victoria's legacy. This episode is especially close to my heart. In April 2022, my mother, Victoria, died suddenly from the complications of a massive heart attack. It was Easter Sunday, 2022, when she began to feel strong chest pains after attending Easter Sunday service. She drove herself to a hospital to be checked out. It is a miracle that she had the wherewithal to be able to do that safely without harming herself or someone else. By Tuesday, she underwent triple bypass surgery, which by all accounts went well. By Thursday, she experienced renal failure, went on dialysis, and passed away on Friday morning. She was a mother experiencing the unspeakable grief of burying her second child just 4 weeks prior, my brother Leonard. But besides this, she had risk factors, including high blood pressure, diabetes, and obesity. And if that wasn't enough, she had a family history of heart attack. Her mother died of a heart attack at the age of 57, in 1979. That was my grandmother, Sadie Green. My mother's passing was a shock, leaving a ripple of grief to those of us left behind. Her story reminds us that heart attacks are not just medical events, they change lives forever. We honor her memory by advocating for truth, transparency, and support for all families touched by heart disease. I love you, Mommy. Understanding heart attacks. What is a heart attack? Well, a heart attack happens when blood flow to a part of the heart is blocked, damaging the heart muscle. This is called an acute myocardial infarction, or MI. What are risk factors for a heart attack? Well, I'm going to list of risk factors. And as you know, this is sometimes passed on, these risk factors, in families. So as I read the risk factors, and if this pertains to you or someone in your family, then you know that you have an increased risk to have a heart attack, or that family member. All right, so here are the risk factors: high blood pressure, high cholesterol, diabetes, smoking, obesity, lack of physical activity, family history of heart disease, chronic stress. I also want to take this time to talk about something called broken heart syndrome. It's also known as stress-induced cardiomyopathy. It can mimic a heart attack, but it is usually triggered by intense emotional or physical stress, such as the loss of a loved one. Most people recover, but it can be serious. It reminds us that emotional health affects heart health as well. So treatment options: stent placement versus open heart surgery. Stent placement, or angioplasty, is a tiny tube or stent that is inserted into a blocked artery to keep it open. This procedure is less invasive and often used for mild blockages. However, if the blockages are not mild, then the person may be a candidate for open heart surgery, otherwise known as bypass surgery. So what happens during this surgery is that surgeons create a new path for the blood to flow around the blocked arteries. This is a major surgery, usually for people with multiple or severe blockages. Both treatments save lives. The best option depends on the patient's condition, overall health, and the number of blockages. So please, whenever you are getting talked to by your physicians, please make sure to understand your risk factors. Please make sure to understand all your options, and please make sure to discuss everything and make sure that you have an understanding. And if you don't, continue to ask questions until you have a full understanding of what is going on with your heart. All right, so now we're getting to the part of the podcast that I really like. We're going to dispel some common myths about heart attacks. All right, myth number 1. Only older people are at risk for having heart attack. Fact: young adults can and do have heart attacks, especially if they have risk factors like smoking, obesity, high blood pressure, or drug use. That is why it is paramount to decrease these risk factors if at all possible. So for smoking, you could limit your smoking or try to quit. For obesity, you could try to lose weight. You can make sure that you get your blood pressure in normal levels by taking medicines. And you can make sure that you do not use any drugs that would give you an increased risk for heart attack. Myth 2. If you don't have chest pain, it can't be a heart attack. Fact: symptoms can include shortness of breath, nausea, jaw or back pain, and extreme fatigue. Myth 3. If my tests are normal, I'm in the clear. Fact: some heart attacks are silent. Regular checkups and listening to your body are key. Myth 4. If you're fit and you exercise, you can't have a heart attack. Fact: while regular exercise and good fitness reduce your risk, they do not eliminate it. Genetics, Underlying conditions like high cholesterol, as already mentioned, or diabetes, and other risk factors can still lead to heart attacks in people who appear very healthy. Myth 5. Heart attacks are always sudden and dramatic. Fact. Many heart attacks start slowly with mild pain or discomfort. Some people may not even recognize the symptoms and delay seeking help, which can be extremely dangerous. Myth 6. Once you've had a heart attack, there's nothing you can do to prevent another one. Fact. Secondary prevention is very effective. Lifestyle changes, medications, and regular follow-up visits with your healthcare provider can significantly reduce the risk of having another heart attack. Defending families, how to prevent heart attacks and recognize the warning signs of one. Number 1, know and manage your risk factors. High blood pressure, high cholesterol, diabetes, and obesity are major risk factors. Regular checkups and effective management of these conditions are crucial. Family history of heart disease increases risk, so be proactive if heart attacks run in your family. Number 2, adopt heart-healthy lifestyle habits. Quit smoking. Smoking damages blood vessels and accelerates plaque buildup in your arteries. Maintain a healthy weight. Obesity increases the risk of heart disease and related conditions. Exercise regularly. Aim for at least 150 minutes of moderate activity per week. Physical activity strengthens the heart and improves circulation. Eat a balanced diet. Focus on fruits, vegetables, whole grains, lean proteins, and healthy fats. Limit sugar, salt, processed foods, and alcohol. Number 3, managing your stress and emotional health. Chronic stress and intense emotional events can trigger heart problems, including what I've already mentioned, broken heart syndrome. Practice stress management techniques such as mindfulness, meditation, or counseling. Number 4, monitor and control medical conditions. Regular screening for blood pressure, cholesterol, and blood sugar help catch problems early. Take your medicines as prescribed by your healthcare provider. And if you have questions or concerns about the medications, please have conversations or ask questions of your healthcare provider so you can understand why you are being placed on these medicines. If you have any side effects, also bring those up to your healthcare provider. We don't know unless you let us know if you're having trouble with the medicines. Number 5, know the warning signs for a heart attack. So here are those warning signs. Number 1, chest pain or discomfort. Most heart attacks involve discomfort in the center or the left side of the chest that lasts more than a few minutes or goes away and comes back. It can feel like pressure, squeezing, fullness, or pain. Number 2, shortness of breath. This may occur with or without chest discomfort. It can happen while resting or doing physical activity. 3, pain or discomfort in other areas. Symptoms can include pain or discomfort in one or both arms, the back, the neck, the jaw, or your stomach. Some people experience nausea, vomiting, lightheadedness, or break out in a cold sweat. Number 5, unusual fatigue. Extreme tiredness or weakness, especially in women, can be a warning sign. So what are some common national and South Carolina resources? So let's talk about national resources first. The American Heart Association, you can go to their website. They provide education, support, and survivor stories. Women Heart, they provide support for women living with heart disease. National Institute of Health, NIH, they have free heart health guides and they do research on heart health. What are some common South Carolina resources? Okay, so you can go to the South Carolina Department of Public Health website, DPH, and they will lead you to local programmings, screenings, and or support groups. There are a lot of other national and local and state resources pertaining to heart health. And so I would just encourage you to Google if you're needing more information on your heart health. Demanding justice, advocacy for equitable care. Justice means ensuring every patient receives fair, timely, and effective treatment, regardless of race, background, or income. Too often, disparities in healthcare access, bias, and lack of resources lead to poor outcomes, especially in communities of color. Advocate for cultural humility in your care and clear communication from your healthcare providers. Unlike cultural competence, which entails learning facts about different cultures, cultural humility invites one to recognize one's own biases and cultural limitations rather than trying to achieve mastery of another person's culture. Cultural humility fosters more respectful communications and trust by acknowledging that understanding a person's complex, evolving identity is a continuous process. Also, demand transparency about your risk, your treatment options, and about follow-up care. Support policies that improve access to heart health screenings and affordable treatment for all families. Your voice matters. Finally, conclusion, call to action. My mother's story and the stories of thousands of patients and families and communities should fuel our commitment to truth and justice. Know your risk factors, learn the warning signs, and advocate for your health and for your family's health. Support one another, seek out resources, and demand the highest standards of care for every patient and family. Justice League, thank you so much for joining me on Justice Rounds with Dr. Jimmell today. I really appreciate your support. If you anyone you think should hear this podcast episode about heart health, please share it with them. Also, if you don't mind, please go to my YouTube channel, Justice Rounds with Dr. Jimmell. Like and subscribe to this podcast for future conversations. Well, I'm going to say goodbye, but together we can dispel myths, defend families, and demand justice, one heart at a time.